Before we demonstrate the lymph node points, let's just quickly review the two different types of nodules or nodes that you may feel. What were the things that we discussed that would correlate to a malignant nodule? What was the three criteria that we kind of palpate or feel for? It could be hard.
Non-painful.
It's going to usually be non-tender / painful.
Doesn't move.
What's that?
Doesn't move.
And it doesn't move. It's fixated. So firm, hard, non-tender nodule, I would be concerned for the potential of a malignant tumor or a malignant node. On the flip side, what would a benign tumor? What were the three characteristics for a benign tumor?
Painful.
It's movable.
Soft.
It's usually soft and,
Painful.
yeah, it usually hurts. All right, so keep those in mind. We will definitely test you on the practical with that, but it's also important to know. All right, so let's kind of start from the posterior surface. And again, everybody should know how to palpate the external occipital protuberance, correct? Mm-hmm. So when you drop down on the external occipital protuberance, basically you end up right underneath the occipital ridge, and that is where your occipital lymph nodes will lie. Now you'll see me do this with both hands. I start from the lateral surface and I work my way in medial. Again, that's just the way I like it. You can certainly do it another way, but just as long as you get the entire length of the occipital lymph nodes. Now, while I'm here, I can go right up to the, what is this? The pre or post auricular? Post auricular. Post auricular. And again, these you can do bilaterally if you choose.
Note the nice rolling motion. Very, very important. Really help you feel if there's anything under your fingers.
Exactly. Just to reiterate what Dr. Lyons said for the video, you want to use a nice rolling motion here. You don't want to push in too hard because sometimes these nodes may be small. All right, so you really want to be able to detect fine nodes. So now we're going to move to the anterior surface of the ear. Okay, and Mike, I'm just going to have you kind of swing your legs this way so we can kind of angle it so everyone can see. And these are called the pre-auricular nodes. Now, as we discussed, I can drop inferior, and we call these the tonsillar lymph nodes. Okay?
Fun fact, those who've had their tonsils removed will often have enlarged tonsillar lymph nodes as a normal consequence.
Mm-hmm. Exactly. Now, I want to move underneath his mandible, okay? You're going to find the angle of the mandible, and then you're actually going to find the mandibular notch, all right? Some people can have a really nice palpable mandibular notch. Some folks don't, all right? Mike has a pretty decent one. So I want to use this kind of a crooked index a little bit so I can kind of reach underneath the mandible, all right? Now again, I'm going to move Mike here so it's a little easier on my back. So can you swing your legs to the front? Nope, yep, you can face, yeah, right in the front there. So again, I kind of come right underneath here. Go ahead and just keep your head straight for me like that. Sure. And if you're finding it tough, like if you find that the patient can't relax and you're putting too much pressure and you're putting their head into extension, just do one side at a time. There's no rule saying you have to do both at the same time. I'd rather you do both at the same time because I don't want this. Because then you're going to strain the person's neck, you're going to jam up the facet joints, they're not going to be a happy camper. All right, so just go ahead and you get both sides in there. Now we come up here and we do the submental. And the submental can be done with one hand. And again, notice how I have some support on the occiput to prevent this, again, kind of extension. Okay, now what I want to do is I want to do the anterior superficial chain. I like to do this, one at a time. All right, again, some people may be a little claustrophobic. They may, and again, too, it kind of just looks a little weird when you have both your hands around his neck. So I like to do superficial. Again, I like to start from the top, and I work my way inferior. You can start from the inferior and work your way to the top. Doesn't matter, just as long as you get everything you need to get. Same here. And again, like Doc pointed out, you can see I'm using a nice, easy rolling motion. Okay, now there's a superficial and there's also a deep cervical chain. So I'm going to have you kind of walk a little bit over this way. All right. So when we're going to point out the SCM, okay? This is your landmark. So if you need help finding the SCM, you can kind of pop it out, you can trap it. How you locate the deep cervical chain is its rotation. And you see how I'm getting my fingers underneath that SCM? And flexion. So flexion and ipsilateral rotation. And now I really can kind of get underneath where I need to get.
You're medial to the SCM?
And I'm medial to the SCM. Again, for obvious reasons, this can only be done unilateral, right? So again, I find his SCM. If I need help finding his SCM, let it pop out, flex him, and I'll rotate him, and I can feel it. Great, okay? All right, before I do the posterior deep cervical chain, I want to now go ahead in the supraclavicular region. These are really, really important, okay? And again, there may be some tenderness because of the subclavius. There could also be some tenderness from a first rib malposition, but you're really just, right now concerned with the node. Does anybody remember there was a specific node in the left supraclavicular region that I made a mention of? Anybody remember the name of that node?
Supraclavicular.
Left supraclavicular nodule. Could indicate gastric cancer,
Lung cancer.
lung cancer,
Starts with a V.
Starts with a V.
starts with a V,
Good.
Virchow's node. Okay, so a Virchow's node. All right. And then the last one, you're coming around here. Actually, why don't you stay there? Mike, sorry, I'm gonna have you swing your legs around the other side so everyone can see us.
He's got
a triad.
He's got a
too.
triad. This Virchow guy, man.
So basically where the trap meets the neckline, I kind of slide my hand in here, and I'm going to give him a little bit of extension and a little bit of ipsilateral lateral flexion. And I'm going to palpate in there. Same thing. Trap, where it meets the neck, slide in, slight extension, ipsilateral lateral flexion. Okay? Any questions? All right. So, what we're going to do now is